Okay, so you've been digging into some information on placenta previa. Huh.
Yeah, looks like quite a bit there.
Yeah, and we're going to take all that and try to kind of like boil it down, give you a clear picture
Yeah,
of what this is all about, right? Without
yeah.
making it overly complicated.
Yeah, break it down.
So you can really get a good handle on this.
Placenta previa,
Yeah, exactly. So
night topic.
placenta previa, um,
Literally after birth first,
right.
which is
When you think about it that way,
kind of a strange term.
yeah, it's like, well, why is that first?
Yeah.
So as we're looking at the information here, it seems like what's happening is that the placenta is
Is implanting in the lower part of the uterus.
okay.
Yeah.
So it's like instead of being up higher, it's kind of
Yeah.
like down lower.
Lower, and that's an issue because it can partially or completely cover
The opening?
the internal os.
Oh, the cervical loss.
Yeah.
Wow. Okay. So that's a problem, right?
Huge problem. And one of the things I find so fascinating about this is that the bleeding that's associated with placenta previa is maternal blood.
Hey.
And it becomes a concern more so in the later stages of pregnancy.
Okay.
We're talking second or third trimester.
Gotcha. So it's not something that is necessarily
Right.
like right away in the pregnancy. This is
No, not usually.
something that happens
Later.
later.
Yeah.
Okay. And, we've got this information here, and it's really highlighting some pretty significant potential risks.
Yeah.
Prenatal and postpartum hemorrhage,
Right.
which is, bleeding too much during,
Early pregnancy or
before, after.
yeah, after delivery.
And then even like perinatal mortality.
Right.
So we're talking about like,
Loss of the baby.
potential fetal death. That's a huge concern, right?
Absolutely. And just the overall implications for,
Yeah.
monitoring and care.
And we also see here placental abruption.
Yes.
This is where the placenta
attaches prematurely.
Oh, wow.
And that's obviously very serious as well.
So there are a lot of things that can go wrong.
There are.
And then also, higher chance of a C-section, an emergency C-section.
Absolutely. And, when we connect this to kind of the bigger picture of, the figures that you've shared, it affects about 4 to 5 out of every 1,000 live births.
Okay, so it's not...
So it's not super common, but it's frequent enough to where it requires attention.
Yeah, you definitely need to pay attention to this.
Absolutely.
And now here's another thing that kind of stood out to me from the information.
Okay.
It was talking about placenta previa versus what they call a low-lying placenta.
Yes.
Can you kind of explain what that is?
Sure. So low-lying placenta is really a matter of degrees.
Okay.
So we're talking about how much the placenta is actually encroaching on the cervical os or the opening.
Okay.
So with placenta previa, it's actually covering that internal cervical opening. Whereas low-lying is when the edge of the placenta is less than 2 centimeters away from it.
So it's not covering it, but it's really close.
Really, really close.
Okay, so it's a matter of proximity then.
Proximity, absolutely.
Okay, and one thing that I found really interesting
Yeah.
is that, like, they don't really know why this happens.
Right. They can identify where it's implanted,
Right.
but they can't figure out why.
Yeah, what the mechanisms are that are leading to that.
Exactly.
So that's kind of interesting.
Yeah.
Okay, so let's talk about, like, managing this, right?
Right.
So let's say somebody has a low-lying placenta and they don't have any symptoms.
Right.
Like, what kind of approach do they take with that?
So the information that you sent said that in those situations, they're going to use transvaginal ultrasound along with color Doppler.
Okay.
And that's so that they can monitor,
So can you explain a little bit about, like, what those two things are?
Sure. So transvaginal ultrasound just means that they're going to be using an ultrasound probe that's inserted into the vagina. And it just gives them a clearer picture of what's going on.
Gotcha. So it's like a better image.
Exactly. And then the color Doppler part is basically showing blood flow.
Oh, okay.
And it can help them assess, is the placenta functioning properly and, where exactly is it located?
So it's not just like a still picture. It's like
It's movements.
you can see like
Exactly.
the blood flow.
Yes.
That's interesting. And this is all to kind of figure out, is it moving upwards as the pregnancy progresses?
Right. Because as the uterus grows,
Yeah.
the placenta might migrate upwards.
So they're kind of like keeping an eye on it.
Exactly. Keeping a very close eye on it.
Okay. And then it looks like there's also some stuff in here about like things to avoid.
Yes, absolutely.
Just to like help prevent bleeding.
Right.
What are some of
So
those?
one of the things they specifically mention is avoiding cervical examinations.
Okay.
So they don't want to do anything that's going to increase that risk of bleeding.
Makes sense.
And then also avoiding strenuous activity and sexual activity that leads to orgasm after 20 weeks of gestation.
So kind of being a little bit more careful with that.
Yes.
Okay, so now let's switch gears a little bit and talk about what happens when somebody with placenta previa does have like active vaginal bleeding.
Right. That's a completely different ballgame.
Yeah, because that sounds kind of scary.
It is. It's considered a potential obstetric emergency.
Oh, wow. Okay.
Yeah. And typically in those situations, they're going to hospitalize you right away
Okay.
so that they can monitor you and the baby very closely.
Yeah.
And that might involve things like fluid resuscitation
Okay.
if you've lost a lot of blood
Right.
or blood transfusions.
Gotcha.
And if you're in active labor,
Yeah.
then they're going to prepare for a C-section.
Okay, so they're kind of like
Immediate.
ready to go.
Absolutely.
Wow. Okay, so that's like a much more urgent
Very urgent.
situation. Okay, so let's move on now and talk about the nursing assessment.
Okay.
So when a nurse is like looking at a patient
Mhm.
who might have placenta previa appear, what kind of things are they looking at? What are they trying to assess?
Well, first and foremost, they're going to get a very thorough patient history.
Okay, so like asking lots of questions about...
Lots of questions and looking for specific risk factors.
Gotcha. And so what are some of the risk factors that kind of jump out in the material?
Well, a history of placenta previa in a previous pregnancy.
Nope.
If you've had it before, you're more likely to have it again.
Okay.
Previous C-section.
Okay.
And that's probably because of the scarring that can happen in the uterus.
Oh, okay. Makes sense.
Multiple gestation,
So like,
twins, triplets.
yeah, more than one baby.
Right. Increasing parity. So that's the number of pregnancies that have reached viable gestational age.
Okay.
Increasing maternal age.
Oh, interesting.
Any prior surgical procedures on the uterus.
Okay.
Infertility treatment.
Okay.
Prior uterine artery embolization.
Oh,
History of endometriosis or abortion.
okay.
Maternal smoking or cocaine use.
Wow. So those are like lifestyle factors
Exactly.
that can impact this.
Yeah.
Okay. Anything else?
Oh, and this one was interesting to me, having a male fetus.
Oh, really?
Yeah, and they don't really know why that is, but it's been identified as a potential risk factor.
So they've just seen that statistically.
Yeah.
Okay, that's wild.
Yeah.
Okay, so that's a lot of stuff to kind of be asking about and looking into.
It is a very comprehensive history.
Yeah. And then what about the physical exam part of the nursing assessment?
Right. So during the physical exam, they're going to be looking for a history of painless vaginal bleeding.
Okay, so like, have you had any bleeding?
Exactly.
Okay, and is that like a common symptom?
That's one of the classic signs of placenta previa.
Okay.
They'll also check to see if you're having any uterine contractions.
Okay.
They're going to listen to the fetal heart rate.
So like with the Doppler or
Exactly, making sure the baby's not in distress.
Okay.
And then they'll probably do a transvaginal ultrasound to confirm the position of the placenta.
So it's kind of like a multi-pronged approach.
It is putting all the pieces together.
Yeah, you've got the history, you've got the
Physical exam.
physical exam, and then also the imaging
Yes.
to really kind of get a clear picture of what's going on.
Exactly.
Okay, so let's talk about nursing management now.
Okay.
So like, what's the focus of that, whether the patient is at home or in the hospital?
So the main focus is monitoring.
Okay.
Monitoring both the mother and the baby.
Okay, so keeping a close eye on how everybody's doing.
Exactly. And that includes, regularly checking for any signs of bleeding,
Yeah.
any signs of fetal distress,
Gotcha.
and then providing support and education to the patient and her family.
Right, because this is a scary thing.
Absolutely. It can be very overwhelming.
Yeah, okay, so when you say monitoring, I'm guessing that involves like some pretty standard checks,
Yeah, they're going to be checking your vital signs regularly.
like blood pressure, heart rate, that kind of stuff.
Exactly. And they'll be monitoring the pattern of uterine contractility.
Okay, and then also pain levels.
Yes, they'll use a pain rating scale to see how you're feeling.
And this is all kind of like ongoing throughout the process.
It is ongoing monitoring is key.
Okay, and one thing that the information made very clear is that in cases of true placenta previa, the plan is usually for a C-section.
Right.
Like that's kind of the standard.
That's the safest way to deliver the baby
Okay.
in those situations.
And there was also a big AK note
Oh, yes.
about something that's super important.
Yeah, this is critical.
Okay,
No vaginal exams.
why is that?
Because a vaginal exam could disrupt the placenta
Oh, wow.
and cause more bleeding.
Okay, so that's like a huge
Absolutely.
no-no.
It's a hard no.
Okay, so you definitely don't want to do that.
No.
Okay, so let's shift gears a little bit and talk about support and education,
Okay.
because that's a big part of nursing care too.
It is.
So what does that look like when we're talking about placenta previa?
Well, it starts with understanding what the patient already knows.
Okay, so kind of like meeting them where they're at.
Exactly. Because you don't want to overwhelm them with information.
Yeah, you want to kind of tailor it to
To their needs.
yeah, what they need. Okay.
And the goal is to provide clear and consistent information
Okay.
about the condition, the assessments, and the treatment plan.
And making sure it aligns with what the doctor is saying.
Absolutely. So everybody's on the same page.
Yeah, everybody's working together.
Right.
Okay. Um, and I also saw in here that the nurse kind of acts as an advocate for the patient,
Yes,
so helping them get information for the family.
exactly. They're kind of the liaison between the medical team
Yeah.
and the patient and her family.
Okay, that makes sense.
And one thing I thought was really interesting that they highlighted in the material was the importance of teaching the patient how to do daily fetal movement counts.
Oh, yeah, I saw that.
And it's kind of cool because it has a dual purpose.
Okay.
One, it provides valuable information about the baby.
Okay.
But two, it gives the patient something to do,
Oh.
something to focus on.
So they feel like they have,
A little bit of control.
yeah, some control over the situation.
Exactly, because it can feel very overwhelming.
Yeah, I bet. And also in the information, it talked about the possibility of like prolonged hospitalization or home bed rest.
Right?
And I mean, that can be a big deal.
It is a huge deal.
Like that can really impact somebody's life.
Absolutely. And so the nurses are really key in assessing how the patient's coping with that,
Okay, so like emotionally?
emotionally and physically,
Yeah.
because bed rest can take a toll.
Yeah, I bet. So they're kind of like trying to figure out like, okay, how are you handling this?
Right. Do you have good coping mechanisms in place?
Yeah, and like what can we do to help?
Exactly.
And then the information also talked about providing distractions.
Yes, because when you're on bed rest, you have a lot of time on your hands.
Yeah, I can imagine.
So things like educational videos,
Yeah.
arts and crafts, video games, books, audiobooks,
Those are good ideas.
just things to help keep your mind occupied.
Yeah, and kind of like keep your spirits up too.
And-
And then beyond like the emotional aspect, there's also the physical stuff, right?
Right, because bed rest can also cause physical problems.
Like what?
Well, skin breakdown is a big one.
Oh yeah, if you're just like laying there all the time.
Exactly.
Yeah.
So the nurses are going to be assessing your skin regularly,
Okay.
and they'll teach you about proper skincare.
Gotcha. So like how to keep your skin healthy.
Right.
And what about like food and stuff?
Yeah, it's really important to make sure you're eating a balanced diet
Okay.
and staying hydrated.
And is that hard to do when you're on bed rest?
It can be because you're not as active.
Right.
You might not feel as hungry,
Okay.
but it's important for your health and for the baby's health.
Okay. And are there any like red flags that patients and their families should be looking out for?
Well, bleeding, of course, is a big one,
Okay.
but also backaches,
Okay.
because that could be a sign of preterm labor.
Oh, wow. Okay. So those are like the things to really watch out for.
Yes, if you experience either of those, call your doctor immediately.
Okay. And then also like sticking to the bed rest.
Yeah, that's important too.
Is that hard for people to do?
It can be, especially if they're feeling okay,
Right.
but it's really important that they understand why they need to stay on bed rest
Yeah. So that they're more likely to.
to comply with the doctor's orders.
Yeah. Okay. And then the last thing I saw in here was about preparing the patient for a C-section.
Right, because in many cases, that's going to be the outcome.
So it's good to kind of like have that conversation ahead of time.
Absolutely, so they know what to expect.
Yeah. Okay. Wow. So that's a lot of information.
It is.
But I think we covered all the main points.
I think so.
So to kind of sum it up for you, placenta previa is this condition where the placenta implants low in the uterus,
Right.
and it can cause some pretty serious risks like bleeding.
Yes.
And so they have to monitor it really carefully, and a lot of times it ends up in a C-section.
Yes.
So it's good to know the risk factors and to know that you should never have a vaginal exam if you have placenta previa.
Absolutely, that's key.
Okay, so hopefully this is giving you a better understanding of what placenta previa is all about.
I hope so.
And as we're looking at all this information, it makes me wonder, given all the risk factors and the fact that they don't really know why this happens,
Yeah.
I wonder, like, what other things could we be looking into,
Right.
to better understand the relationship
Well,
between,
a mother's health and the development of the placenta.
yeah, because it seems like there's still a lot we don't know.
Absolutely.
So that's kind of interesting to think about.
Yeah. It is.
Well, hey, thanks for diving deep with us today.
My pleasure.
We hope this has been helpful for you,
Absolutely.
and we'll see you next time on The Deep Dive.
Sounds good.